this infection? I mean, from a hygiene point of view, like we
Yeah, so there are certain, yes, Sandhya?
yeah, so we know that, though cervical cancer was the number one cancer in women about a decade ago, it was the number one cancer, and breast was after that. But now breast has overtaken cervical cancer, and that is the number one cancer. And even before the vaccine came into use, and even before testing, screening came into use, we found that actually cervical cancer, the numbers were coming down. So is that a lot to do with, improved menstrual hygiene and the way women were taking care of themselves?
Yeah. See, the basic thing, there are some couple of points which we must remember as to, at least to some extent, prevent us from getting HPV infection. And the most important thing definitely is safe sexual practices. Monogamy is recommended, having a single partner. Use of condoms, like I've already discussed. As far as possible, avoid orogenital sex. And like you rightly said, maintaining proper genital hygiene. Whether it is on a daily basis, unfortunately as women, our vaginal and our anal orifices are very close, unlike the men. So whenever especially when we pass urine, if we want to wash and wipe, we can wash from the front, and the wiping always has to happen from front to back and not the other way around. Regarding menstrual hygiene, yes, one of the main reasons probably is earlier they were using all these cloths in order to sort of accumulate the menstrual blood, and they were being washed and dried in very damp, dull places. Now with this thing of course, now we all don't agree with the use of menstrual pads, because menstrual cups have come into the picture, and they are actually by far the safest if the woman can make up her mind to use it. Or along with that, there are some nice cotton sanitary napkins which are available, which are again very, very eco-friendly. That is the second thing as far as maintaining genital hygiene on a daily basis, and very, very important even during menstruation. Another thing I want to emphasize is that all mothers should actually tell their daughters that frequent changing, if they're using any kind of pad, frequent changing of the pads is essential, and not to wear one pad right from the morning and let it soak through till evening, because it causes a lot. Blood is a very potent source of, it's a medium in which organisms can grow, so the quicker you dispose it, the better it is. Lastly, what I want to tell you is, you must have regular gynec checkups, especially if at all a woman is having frequent episodes of white discharge, which may be smelly, which may cause itching, and or bleeding in between periods, some kind of disturbance in her menstrual cycle. It is very, very important for her to go to her gynecologist and have the testing, which will be discussed in detail later by Dr. Jyotsna. But whether it's for the HPV testing or for the pap smear, as recommended by her gynecologist, this has to be done on a regular basis, so that we can pick up any kind of infection or any kind of changes at the earliest and start treatment as required.